Most people have no idea what protein is and why we don't recommend it. So, you have to understand all these things. Why is protein bad for your kidneys? Because it's high phosphorus and it leaches calcium to get a balance. It'll push out calcium and magnesium. Plus, it's all acidic. It's dead tissue. If it's not an animal protein, then it is a protein that is dormant, that has enzyme inhibitors, high phytic acids like beans, things like this. Totally bad for your kidneys. Totally bad. All proteins rip the GI tract. Study after study after study has proved that protein is linked to colon cancers and kidney failure. People don't realize the overconsumption of dead animal meat has ingested in the human lots of epinephrine and norepinephrine. Well, these are the adrenalins. Well, because of that, the adrenal glands have shut down because they've sensed too much epinephrine in the body. So you see that a lot when you take someone that's been a meat eater and you take them off of meat and you start to put them on raw fruits and vegetables. They'll come in really tired and fatigued and they'll say, I got to have my meat for energy. Well, guess what? Your body doesn't burn protein for energy. It burns sugar for energy. It burns carbon and oxygen like your car does. So the protein isn't burned for energy, and you don't want to burn it for energy. That was Atkins' philosophy. Starve the body for a sugar, which is essential, and the body will return to its fat reserves and convert fat or glycogen back into glucose. Well, you had to eat high protein to get above the sugar and the fat to do that. The problem with it, extreme acidosis, excessive fat breakdown, ketosis, and same thing basically, and pretty soon a lot of people died, had open heart, had a lot of problems with the acidosis. This is insane. Now there's another medical doctor pushing a high protein diet. What are these guys? I don't know where these guys come from. They need to start reading some books and learning outside of their modality. They're hurting too many people. Dr. Morse, can you explain the danger of high-protein diets on a level of biochemistry? I remember when you said how a medical doctor told you he gave his patient protein and leukemia skyrocket. Can you explain how protein can do this? Well, protein in a lot of ways. I mean, you have high phosphorus, high iron, mostly in high-protein foods. High phosphorus, high iron actually depletes the electrolytes out of the human body, so it gives you more of an acid hit, an acid experience with that. Proteins are probably the most abrasive to the mucosa there is. Creates a lot of excessive mucus. Most of the immune responses is toward proteins. From a biochemistry viewpoint, it's as simple. It unbalances your electrolytes. And it's particularly the twin, or at least not the twin, but the older twins can get beat up a little bit. Cal-Mag, particularly the calcium side of it, can get real beat up with a high phosphorus diet. Obviously, these are acidic diets. But beans and things the same way. These are dormant foods with enzyme inhibitors. They're high in the phytic acids, which is another antagonistic principle to calcium. So these type of factors are involved in, in that mucosic responsive, immune responsive, high acidic. All these factors actually. And of course, the more proteins you hit the kidneys with, the more you damage the kidneys, because again, acids have more of a corrosive effect on the human body. This whole protein myth has to be buried, because protein is the problem. Proteins is the most immunoresponsive of any chemistry out there, and yet they tell you to have more of it. All right, what body are you wearing right now? You've got 4 vertebrae. Are you an omnivore? Are you a herbivore? Are you a carnivore? Or are you a frugivore? Well, that's easy. Just go dissect one, kill one. You don't have to. We already have done that. So we can look at the anatomy and the physiology of all these different species, the 4 vertebrae, and to tell you the truth, there's only one that comes razor close to us. That's the frugivores. We are acting omnivorish, no questions. But even when you look at the omnivores, very few omnivores eat the level of protein Homo sapiens do. It's amazing. Homo sapiens eat more protein than most omnivores. What the hell is that? More than bears? More than... absolutely. Demineralization. That's what I'm saying. Demineralization. happens in an acidic medium, guys. So let's go back to meat eating. Demineralization, because what is it high in? Phosphorus. What's your teeth high in? Calcium. Has phosphorus, but there's calcium is the top. You pump the phosphorus and you push the calcium out. And so protein is well known to rob calcium out of the body. So when we say come off of high proteins, there's multiple reasons why. Multiple reasons why. No, well, we can't use starch like we can't use protein. These are complex structures that can't be used. I mean, just understand how a protein has to be broken down, back down to the amino acids, through the peptide stages before you can get to use it. So why consume a protein when you've got, your body has to break it all the way back down to amino acid, and I eat this right now, I'm getting my amino acids directly. Why should I waste my body's energy and time? It does nothing for me but weaken me. And it acidifies me because it's an acidic process. When you get complex chemistry, generally acids are involved because complexity, you need the big boys. Why are we even focusing on dead tissue and proteins and stuff like this? You know, these aren't nutritive foods. Dead tissue is dead tissue. That's dying cells and stagnant blood. Putrefactive, nasty, brings in the worst of the bacteriums, brings in the worst of the worms. You know, this is the protein side. This is the wrecking ball side. And it's just, protein is a byproduct of consumption of nutrition. Except for your nuts and your grains. And when you get into these are dormant foods. Look at your beans. High phytic acid, high enzyme inhibitors, is dormant. So we sprout. You know, and sprouting, of course, germination, then you've got the life coming in, the chlorophyll's coming in, everything changes in its chemistry. Enzyme inhibitors are broken down, phytic acid is shoved out, and everything is cool. But not so in their dry states. And I think soaking them overnight isn't enough to change their whole chemical makeup at all. So just not good foods. And I don't know why we're fixated on dead foods as opposed to living foods. Living foods. You know, I sold a lot of beans and grains and stuff in my health food stores, and particularly to an Indian restaurant, but I sold a lot of that, you know, and I'm looking, and at the time I didn't know any better. Well, you know, these are all health foods, right? I was a raw foodist first, thank God, because I was able to see what that kind of eating did to my body, because I was a fruitarian, then went backwards, thinking I was going forwards. You know, proteins stimulate and make you erratically nervous and stuff like that. They're acidic, they're stimulants and stuff like that. And that's what we generally go to proteins for, stimulation, not to mention the neurotransmitters from the killing of the animals and how that picks us up from neurotransmitters. Can't do it that way, though, and still remain healthy. But the fruit, it just calms you. It increases nerve function. Strong nerves makes for calm. Not excitement, it makes for calm. Your babies raised on raw foods will be calm, not like a little baby scurrying all over the place. They will be calm. I mean, that you see that in babies, you see it in adults. I experienced it myself. It's a calmness that settles over you. It's an energetic calmness. It's a consciousness calmness. Yeah, it's not a jittery mental thinking. You know, the more agitated your nervous system is, it stimulates the central, which stimulates the mind, and it causes for chattering of the mind. So to calm the mind, that's why people fast. It's also, fasting calms the mind, which calms and allows the consciousness to come through a little more. That's for those that can't control the mind. Matter of fact, if you study this, most immune responses are against proteins of all types. Dairy glutens, all types of proteins. Milk proteins, your body just doesn't deal with proteins well. Remember, inflammation is just a product of proteins or acidosis. You know, that's the initiating response to inflammation. Inflammation is a natural immune response to what? Why would you have inflammation in the body? What's the body trying to attack? What's the body trying to get rid of? What's irritating or affecting it negatively? Well, there's only two sides of chemistry, and remember, everything is chemistry, so take your pick. Pretty easy, don't you think? Don't have to go to 10 years to school to do that one. So acids, no question about that. How much protein does a mountain gorilla get, and how many how many humans would it take to bring down a gorilla? You see what I'm saying? I mean, this concept of protein is idiocy. You don't want proteins, you want amino acids. Well, amino acids form all things. So all structures, especially of course in the food kingdom, are made of amino acids. So your body arranges amino acids as they need them. But you have a lot more in your body than muscle tissue. So this whole idea of proteins is way out of balance. And you don't want to get into proteins. You'll lose your calcium, you'll acidify your body, you'll fill your body full of mucus. These is what damages cells. Look at cancer cells, and what's all around a cancer cell? Proteins. It's like the cell's inundated with acids, and then here comes the lymph system with all the mucus to try to stop the protein. That's a cancer cell. The only way you're going to feel tired is with adrenals. If your adrenals are real low, and you come off of your stimulants like meats and coffees and pops and things, you could have a little crash. When you feel that, you don't feel that, you feel exactly what's going on. You feel tired. It's not the detox. You're having better chemistry, more energy than you've ever had, better digest. But why do you feel more tired? And that's you're away from your stimulants. You're away from your neurotransmitter meats, the stimulations of proteins, the inflammation of the kidneys, and now everything settles down to its genetic memories. And that's what you really get to see where you're at. That's then when you begin to feel your weaknesses, because your body's going to say, look, you got a knee here, and then it fixes it. Now you got a hip here, and then it fixes it. Remember, protein, you're all gonna get a good view of why we say no protein. And it's not a pretty picture, because we've been brainwashed with proteins. Well, if you think your body needs protein, then you have to agree your body needs starch, and then you have to agree your body needs fats, concentrated fats, because they all are the same variety. But if you're smart, you know your body requires amino acids, not complete amino acids, which are complex proteins, are made of them, but they're just complex to the point it's hard to break them apart. Then you got the polypeptide stages you got to deal with there. So you got quite a bit more to deal with than just simple amino acids. You know what I'm saying? And simple sugars and simple fatty acids, those are mandatory. But when you complex chemistry, no longer can the body deal with it. Yet we push complex chemistry. I don't get that. Anything that's protein is going to cause spasms and convulsions and seizures. Simply because a high protein food is calcium restrictive. It's antagonistic to calcium, in other words. Because you have a little higher phosphorus ratio, you're going to leach your calcium out. You always see that. So anything that's high phosphorus, like soda pops, your phosphoric acids and stuff, your meats and stuff, your beans, are going to be antagonistic to calcium. That's just the way it is. Actually, the only foods that are not really antagonistic to calcium are your fruits, your berries, your melons, and your salads. Those are the only foods that are not really antagonistic to calcium. Most all the other foods are at one level or another, even milks. Because remember, when you pasteurize at these levels, you literally bond your chemistry to where there's no way you're going to break that apart. And that's the problem in high heat injection of food sources, is the bonding, extreme bonding of chemistry. You actually eat a high protein. Matter of fact, we were just, I don't know if I read it to you guys, but there was just another study showing that high protein diets throw people into diabetes. Why? All right? Kidneys. And the kidneys then, what's on top of them? The adrenal glands. So when the kidneys go, so does the appendage, the adrenal glands. And it's called, there's the sugar metabolism, there's the autonomic nervous system, there's the mineral utilization, there's the gonadal steroids, there's all these things. Because high protein leads to high blood pressure big time. What happens if people have high blood pressure? They're on these high protein diets. We take them off the proteins. Guess what happens to the blood pressure? For many, fasting is way out there to do. And hard for a lot of people. They're so used to the high protein diets, the heavy meals, the high starches, that when you're talking about fruits and vegetables, they're hungry all the time. They're starving. They're not starving, but they're coming off of this insane high protein, high stimulating diet to a very simple, energetic, high nutritive diet. And it is hard for them to understand that you must work through this doorway to achieve wellness. And keeping yourself a little hungry is always good because it allows for better detoxification. Also, you should hear what the dietitians have to say about what to eat and not to eat. Oh no, I know. They cheer on the meat, but the fruits, they make it sound life-threatening. Isn't that funny? Isn't that funny? It's almost regurgitating that the medical people are still lost in the protein myth. This protein myth has been negated by other medical doctors, good medical doctors, since the 1800s. Been a lot of good books written by a lot of great higher awareness medical doctors telling people about the protein myth. And that's just what we're in. We're in a protein myth. And that myth is so bad, it's killing a lot of people. And until they get off of protein, you can't fix the kidneys. It'll continue to deteriorate. The body does not do well on proteins, nor fats, nor starches. It does great on sugars, simple fatty acids, and simple amino acids. So when we complex, the body starts struggling at all levels. And just remember, that's why simplicity is always the key here. Going back to simple foods returns simplicity. Now we have to fix things. When you're in pain, what's the one type of food you do not want to consume when you're in pain? I heard you over there, Sarah. Proteins. Proteins. You don't do proteins when you're in pain. Give yourself this little experiment. If you're in pain, spend a week or two on all raw until the pain, pretty much you got control of that. Then go out and have your protein meal and you tell me how you feel. I've used that experiment on a lot of people to prove my point. Look at this. Any one of you can take a 30-day raw food diet. And then after 30 days, or even 2 weeks, go out and have you a cooked meal of meat and potatoes and all that. You know exactly how you're going to feel. And if you don't, you should try this. Because it's not me you need to believe, it's yourself. You need to experiment and try these things. You don't want to disbelieve people by the mind, because that's completely conditioned. Wrap on the robe, strap on yourself on the bull, and take a ride, baby. And then you'll know for yourself. And then you don't have to believe anybody. Zero protein. Zero protein. So zero protein. Get your amino acids from where all the strongest animals do. The primates and the herbivores, all the horses and elephants and cows. These guys lead perfect examples of why meat eating is on the negative side. Look at the animals that are more meat eaters. They're more violent, they have less endurance, they sleep a lot, that sort of thing. Yeah, plenty of amino acids in vegetables and fruits. Plenty. And you want more than just amino acids. You want the power of the nervous system, which you don't have. You want the power of epinephrine and norepinephrine, which you're low in. You want the power of all these things. You don't want popped up cortisol levels. And vegetarian protein amino acids, you walk real careful. You're still bringing too much nitrogen into the body, and you're going to create acidosis from this. Even from vegetable proteins, you got to be real careful with amino acids. What do you need so many amino acids for? That's the problem. We have a misthought about amino acids. Pump the greens. There you get plenty of amino acids, okay. I'd rather see you pump the greens. If you want amino acids, pump the superfood blend. Don't pump a protein powder from aminos. No. Now you have a chemical, you have them extracted. Now you have lost magnetics, you've lost everything, and now you have high nitrogen. You're walking down the same road. No. I can tell you when you study proteins and you study health, there is no way protein is a healthy sort of substance. The body can't use protein at all in the first place. When you examine the digestive process of proteins, you find that amino acids is more the issue. The other issue is that when you look at the human body, it is not designed as a protein-eating species. It does not have the level of hydrochloric acid. It does not have the short intestinal tract for putrefaction. It has major absorption, which is much more than the omnivores and the carnivores. Carnivores are completely a different structured animal. Well, I'm going to tell you, I've seen well over 150,000 people, and I've had 40 years of this. Those people that are diabetics, check your blood sugars. If protein makes your blood sugar go up, especially when you're controlling it well with carbohydrates, fruits and vegetables. Have a protein meal and see what happens to your blood sugars. Also, there was a comment made that, of course, when you have real kidney weakness, you can't do proteins because it hurts them. Now let me see. When you have a weakness, protein can hurt it, but protein doesn't hurt you until you have a weakness. What kind of chemistry do you think makes the weakness in the first place? It's protein. Because carbohydrates don't beat you up. Carbohydrates are mainly base chemistry. So you're looking at protein, which is more the acid side of chemistry. That's the nitrogen side. And even though medical doctors have nitrogen all screwed up in their minds, too much nitrogen is acidic. It really breaks down. You have proteins that are not as acidic, and you have proteins that are very acidic. And you could say that about complex sugars. You could say that about starch too, that basic sugars are more base, and then the more complex chemistry, you get more acidic. And you could say that about all of that. There's been years of study of protein consumption and the effect upon colon cancer. And last year was a 30-year study linking protein diets to colon cancers. I have people in here that followed the Atkins diet that lost their bladder, that had strokes, had heart attacks. It is unbelievable what proteins do. If you want to continue to eat protein, that's up to you, my friend. But this channel will not promote the use of proteins whatsoever. All I can say is that there's so many reasons why that you would not do proteins. And I can tell you, there was a mention about bodybuilders in here. I've got a bodybuilder right now that if you mention high protein diets, he'd probably co-cock you. He's just one of many that I have, professional athletes that now have rheumatoid arthritis. A couple of them are in surgeries now because of what the proteins did to the kidneys and the effect that backed up into the lymph system, creating extreme acidosis, the extreme loss of calcium, and the loss of bone tissue, and then the end result of extreme body pain. Arnold Schwarzenegger's another example of that process. Some of these people have had to have open heart and stuff like that. There is absolutely no bona fide conclusion that one would have a high protein diet. It doesn't fit in our species. It doesn't fit in chemistry. It's the acid side of chemistry. It doesn't fit in any shoe that you put it on. It doesn't fit anywhere.